All right. All right. So far, we've really just been looking at supply and demand for healthcare services. Um, but of course, we know that the healthcare market is unique because it kind of has three parties, right? It's not just buyers and sellers. There's also this sort of intermediary uh, insurance companies, right? So that's what we're starting to look at today. Um, Beginning with demand for health insurance, right? And then we'll move on to supply and then government provided insurance. So, okay. So as far as what you should be trying to learn from this chapter, um, we're going to discover sort of the basic principles of people's dislike for risk, particularly financial risk, and the different ways that people can deal with it. We're also going to grapple with the complex risk aversion model. I'm not really sure what the book means by hopefully winning at least 2 falls out of 3. I guess it's referring to a risk, right? You also want to be able to master sort of this difference or distinction between the premium, what's called the risk premium, and the price for an insurance policy, as well as learn the basics of insurance policy pricing. Then once we're able to understand sort of how pricing works for insurance policies, we want to be able to integrate information on demand for medical care into the model of demand for health insurance, because we can't really separate these two demands, even though they seem like they might be separate. That they're integrated, right? And we also want to understand how this thing called moral hazard loses effect, or sorry, losses moral hazard losses affect the demand for insurance. You also want to learn how health insurance markets run the risk of some type of market failure. And this is typically because of some sort of asymmetric information between the insurance company and the patient, and the different ways that insurance companies can potentially avoid the problem of these market failures. And lastly, we want to be able to understand the role of employer-based insurance in the United States and some of the major effects that tax laws can have on the demand for health insurance. And this is particularly important when thinking about the Affordable Care Act. Okay, so to start off thinking about this stuff, it's kind of important to think about the fact that there are financial risks all around us, all over the world. Um, right? When you drive your car, there's a risk that someone will hit you or you'll hit them. There will be damage to vehicles and potentially injuries. And all of those things cost money, which is why we have car insurance, right? If you own a house, there's a risk that it could burn down or it could be damaged by weather or a falling tree or something, right? And those all involve costs, right? So people and businesses can purchase all different types of insurance to protect themselves against these things, right? So home insurance, car insurance, liability insurance for businesses, right? When they mess up, they're covered against those financial risks, right? Health insurance is quite possibly the most pervasive type of insurance. And to think about that, at least when this book was published, 80% of people were covered under some kind of health insurance, whether it was private or government provided. And that number has probably gone up slightly because of the Affordable Care Act. And in fact, the Affordable Care Act, the intention of it is to get that number to 100%, right? And some of these government insurance programs, just to name some of the programs that are provided by government, we've already heard of Medicaid and Medicare. But there's also the Supplemental Children's Health Insurance Program, also known as SCHIP. And we'll talk about those 2 chapters from now, chapter 12, I believe. All right, so here's just some figures on the percentages of people insured via different types of insurance, right? So, we could look at all ages. 61% of all people get insurance through their employer. A very small fraction gets private insurance in some other way. And the total private insurance is almost 2/3 of the entire population. 14% are on government insurance for a total of 80.1%. And then you can see the different breakdowns according to age. Let's see. It looks like, for people under 18, a lower fraction of them are covered by employer-based health insurance than older people, which makes sense in a lot of ways. People under 18, I guess they would be dependents on their parents' insurance more than likely. But then that percentage goes up as you get into higher age brackets. You can see that there's a large proportion of people under 18. Let's see if I can get my laser pointer. Come on, it's not giving me the option. There we go. You can see that there's a large percentage of people under 18 that are covered by government insurance, and that's probably a large fraction of that is coming from the SCHIP program, right? The Children's Supplemental Health Insurance Program. So needless to say, there's a lot of people on health insurance of some kind, right? So it's very common, pervasive. I think maybe the only other insurance that is as common is maybe car insurance, but I don't know the figures on that, but everybody that drives has to have car insurance. So, but aside from that, health insurance is probably the most common type of insurance that's out there. And like I mentioned a minute ago, we have this kind of interesting scenario where we have health insurance companies playing a role in this market. And so we can't really separate the demand for medical care from the demand for health insurance, right? Because they're essentially going to affect one another. In a lot of ways, it's an endogenous relationship, right? So unfortunately, we can't separate them out. It's going to make the analysis a little bit more complicated, but nothing that we can't handle. So thinking about this, it kind of begs the question, is it easier to think about the demand for health insurance first, or should we think about the demand for medical care first and then kind of work our way to the other one? And we kind of already did this actually when we thought about the effects of insurance on the demand for medical care, right? We saw that it creates steeper demand curves, right? So we kind of did this already, right? And we kind of ignored the demand for insurance when thinking about the demand for healthcare, but we could still think about the effects of different insurance plans, right? But in this chapter, we're going to think very specifically about the consumer's choice of insurance, right? How do they select insurance, particularly when taking into account how the insurance will affect their demand for medical care. All right, so first we need to think about the risk, right? Where is the uncertainty coming from that creates these financial risks that people want to insure against? Well, it's really just the random nature of health and illness, right? And we've talked about this before, right? The things that affect your health are more or less random, right? If you get in a car accident and get injured, that's pretty much a random event, right? If you get the flu, that's pretty much a random event. So that's really where the uncertainty is coming from, is the random nature of our health, right? So for a rational consumer, the rational response is to seek a cure for their illness with appropriate medical care. But of course, this creates a financial risk, right? If you just randomly get sick and you need medical care, that costs money, right? So that is a financial risk created by that. And the whole point of health insurance is to help consumers and patients protect themselves against this derived risk, right? So to start thinking about this, we're going to kind of start with an unrealistic hypothetical. Okay, so imagine there's a world where there's no medical care. Medical care is not a thing. So um, you can't purchase medical care to improve your health in any way, right? Would people still buy insurance, health insurance? Well, the answer is interestingly, yes, they actually might still buy insurance against the risks of poor health. Now, how would that work exactly, right? Well, we can imagine in a world without medical care that each person's health or their stock of health in a lot of ways kind of like a unique and irreplaceable object, something that's invaluable, right? Maybe like a Dali painting or a Picasso painting, right? If it's destroyed somehow, there's no getting it back, right? Especially in a world where there's no medical care, right? Um, and so, of course, any kind of loss of health is going to be tragic potentially if the injury or illness is severe enough, and there's no amount of money that can replace these types of unique items, right? But with insurance coverage, if there's an insurance benefit that can be received, then at the very least, a person could purchase something that's a close substitute, right? Um, right. So if we lose a Dali painting to a fire, we can at least purchase something that's similar, right? Maybe a painting by a different master or something, right? And so this is actually kind of how life insurance works, right? Um, right. The point of life insurance is not to replace the loss of the person, but it can act as a substitute for their loss of income, right? It can be a substitute for their earning power, and that's the whole point of life insurance, right? Um, it's really to protect the people that you love in case you lose your life, right? Particularly if you're, in a marriage with a family, and you're a husband or a wife, and you've got kids, and you lose your life. Um, your family loses your lifetime income because you no longer are living, right? So life insurance covers at least a part of that loss for the family. So that would be the kind of way that health insurance would work in a world where there was no medical care. Um, but of course, we have medical care, so. um, but you can kind of see, the ideas of financial risk in that hypothetical, right? Um, so to begin to understand this issue and how it derives demand for health insurance, we're going to start with a really really simple problem, right? This is how we always start in economics, right? We start with the simplest model possible and then slowly build it up to be more realistic, although it becomes a little bit more complicated, right? So we're going to assume that there's a world with only two random states, and then we're going to use indifference curves to sort of analyze the outcomes of these possible states. So these states, we can basically just call them state 0 and state 1. State 0 is where there's an economic loss or a financial loss. Um, and it has a probability of occurring, probability P, which of course is somewhere between 0 and 1. And then the other state, state 1, is the world where there is no loss, and that occurs with probability 1 minus p, since the two probabilities have to add to 1, right? If these are the only two possibilities, then their two probabilities have to add to 1. So if there's insurance available, a consumer can shift their income between these two states, and it would be in a scenario where the insurance is charging a market determined rate that we'll call gamma. And you can basically determine gamma as the derivative of income in state 1 divided by the derivative of income in state 0. You don't have to worry too much about that. We're not really doing too much calculus in this class, but just for your information, right? Now, a good way to think about what this gamma is, it's basically kind of like a price almost. In fact, it's like a relative price, right? We can think of it as the relative price of income between the two states of the world, the good state and the bad state. Now, it's kind of weird to think of income having a price, but that's really a useful way of thinking of it. All right, so let's think about this in terms of our indifference curve, right? So basically, like normal, we have two goods on the axes, right? On the x-axis, we have income in the bad state. And on the y-axis, we have income in the good state. And then there's a budget line, right? The consumer can basically shift their income between these two states using the insurance. Okay, so if the consumer initially has an endowment E, they can actually achieve a higher level of income a higher level of utility by shifting their income from one state to another. So they can actually achieve a higher utility, U2, by shifting their income, some of their income from the good state towards the bad state, right? That's basically what would happen. And they're doing this through the insurance, right? So the budget line, right? This is sort of their possibilities, right? Their consumption possibilities is a good way of thinking about it, right? It's like a PPF in some ways, but it's just a budget constraint. And like I said, it allows the consumer to shift income from state 1 to state 0 at this gamma, at this rate of insurance, which, by the way, is the slope of this budget constraint. Now, it's not really easy to tell this from how it's drawn, but these curves, these indifference curves, are drawn in such a way that income is more highly valued in the bad state, which makes sense, right? If you're healthy, $1 is less valuable than $1 if you're sick, right? In other words, the marginal utility of money is higher when income is lower or when health is lower. I guess that's, I think, a better way to say it is the marginal utility of income is higher when income is lower. Well, that's true, but also you could think of it as health being lower or the state of the world being worse, I guess, right? Okay, so like I said, this initial endowment is not going to be in equilibrium, right? Because the consumer can shift their income from the good state to the bad state and get to a higher level of utility. This E star. So E star would be the equilibrium. Also, this certainty line is basically when income is the same in both states. It's a 45-degree angle, right? So in a sense, that's like what the what the consumer could get with certainty and not have to face any risk. Now, of course, this E star here, this E star point is the highest level of utility that can be achieved, right? The consumer can't get outside of their budget constraint, in other words. All right, now this point E star has some interesting properties. So the underlying risk of the bad event has the underlying odds of P over 1 minus P. Okay, so P again is the probability of the bad state, right? And it can be useful to normalize the price of insurance, this gamma, it's useful to normalize it relative to those odds, that relative probability. So we can rewrite gamma as this underlying probability of the bad state times gamma star, where gamma star is quote unquote the real price of insurance, and the P over 1 minus P is called the actuarially fair odds of the risk. So if you've heard of actuarial sciences, those are people that basically figure out the costs and prices of insurance. So one way to think about what gamma star is that it's the markup that the insurance company charges above the rate that's actuarially fair. Okay. Um, and when there's an equilibrium, the ratio of marginal utilities of income, which was the derivative I showed you earlier. Let me go back to it real quick. Where is it? Come on. This thing here, right? The ratio of marginal utilities, that's what that is right there. It's also gamma, right? Um, right, so the ratio of marginal utilities of income in these two states equates with this gamma star here. Okay, so why are we taking this really basic approach to start? Well, it's because it's revealing to us this really basic point that people with preferences like this want to shift their income from good times to bad times, and that's the whole point of insurance, right? You pay the insurance some money so that in the event that something bad happens in the future, you have that income in the future, right? So this is exactly the mechanism that insurance provides, and it's a way for consumers to actually achieve a higher level of utility, right? So one useful way of thinking about this is that insurance is, in many ways, just like a normal good, right? Um, there's more of it demanded when the price falls, right? So, um, and this is only really true as long as we can define the price appropriately as gamma star. But but it's a normal good, right? If people's incomes go up, then they'll buy more of it, right? All right, so this is helping us set the stage for this really much more complicated approach that we're going to take to understand the problem of consumers' choice of insurance and why they even desire it in the first place. Okay, so it seems pretty obvious that most people, at least, dislike risk, right? They're risk averse, um, and the purchase of insurance helps solidify this, right? That's very direct evidence. We see all types of insurance, so it must be that people don't like risk. Otherwise, why would they buy insurance? In fact, if they liked risk, then they might do something the opposite of insurance. They might pay to do crazy things like jump out of airplanes, right? Some people do that. Um, but because people willingly and often pay for insurance, um, they also, by the way, pay more than the average loss that they expect. So this is really indicative of the fact that people don't like risk, right? So just to give you an example, right? Suppose that I said I'm going to flip a coin, and if it's heads, you got to pay me $50. If it's tails, you don't have to pay me anything, right? So if it's heads, you lose $50. Um, a risk averse person, well, first of all, let me start with this: the expected loss is $25, right? because there's a 50% chance you lose $50. There's a 50% chance you don't lose anything. So the expected loss is $25. A risk averse person would pay something more than $25 to just not even have to go through that gamble, right? That's basically what we're saying here. Right. So people that behave this way, we describe them as being risk averse, right? They don't like risk. And there's actually a really nice, elegant way for us to incorporate risk aversion if we make a simple assumption about people's utility functions, particularly their utility functions over income. So although this is a more complicated approach, it's actually very elegant in a lot of ways. So remember that, back in the early chapters, when we were talking about the demand for the demand for healthcare, we described a person that has a utility function that that incorporates their demand for normal types of goods, right? That's what X is. So cars, clothing, food, right? And then H, which is healthcare, right? You guys remember that? And there, both of these things had positive marginal utility, right? The more X, the better. The more H, the better, right? So in that sense, marginal utility is positive for both those things. And since income can be used to purchase X or medical care, right, which is increasing H, we can basically say also that the marginal utility of income is positive as well, right? Because it can be used to buy these things that themselves have positive marginal utility. And so the simple assumption that we have to make is that the marginal utility of income is positive, but while it's positive, it's also getting smaller and smaller as the person's income gets larger. So in other words, diminishing marginal utility. So it's positive, right? Marginal utility is positive, meaning utility is getting bigger, but the marginal utility is getting smaller, so that the utility function is going to be basically getting flatter. Okay, so here we go. Here's the picture right here. So very simple utility model. The only thing that matters is income, and of course, more income is better, right? Higher utility, but the more income we get, the smaller marginal utility becomes. And remember that marginal utility is simply the slope of the utility function at a particular point. So at this low level of income, the marginal utility of income is very high, right? This steep slope. But then as income goes up, the slope gets flatter, so the marginal utility is getting lower, right? And maybe you've seen something like this before. Has anybody seen a utility function like this? Yeah, okay. Yeah, so if you've ever learned about risk aversion, you've probably seen this before. So somebody that has a utility function like this is inherently risk averse and will always prefer a less risky situation to a riskier situation, everything else being equal. Right, and this again is diminishing marginal utility. So this idea is basically central to the question of why people buy insurance, right? If this is what people's utility functions look like, then yes, they will buy insurance because they're risk averse. So there's not too much that's new here, right? We still have the same consumer decision problem. They're trying to choose the insurance plan and price that maximizes their utility, given the fact that they face these two different possible worlds, bad state and good state. So maybe not as complex as maybe we initially thought, right? All right, so we can start to really get a grasp of what's going on here by thinking about a very simple gamble, right? So suppose that the person we're thinking about has the utility function we just saw, and they start out with the higher income, I2, but they know that there's some there's some externally generated risk that they have no control over that could potentially reduce their income to the lower level of income. Now, of course, these risky events have probabilities, right? So let's just say that this risky event that reduces this person's income happens with probability F. If that's true, then we can calculate the expected income, right? And the statistical expected income of this person would be the probability of the bad outcome times the bad outcomes income, right? So that's the probability that the world is bad and they have low income, plus the probability that the world is good and they have good income, right? So that's how you calculate expected income in this example. Pretty straightforward, right? It's the same thing I did when I calculated the expected value of that coin toss, right? I did the same calculation, just using the probabilities and values in the example I gave. All right, so we're going to go back to our utility curve with a few more things labeled. We're going to add some numbers to this chart. So for this next picture, we're going to assume that the probability of the bad outcome is 0.4, so 40% chance that the outcome is bad. The higher income is $20,000. The lower income is $10,000. So with these numbers, we can calculate the expected income, right? The expected income is 40% chance of getting $10,000 plus a 60% chance of getting $20,000. And that ends up being $16,000. Okay, so that's the expected income. All right, so that's what we have. We have the low income here, the high income here. And basically, we're finding a weighted average of these two incomes, right? 40% chance this happens, 60% chance this happens. So the expected income basically falls 40% of the way between these two numbers, right? Although it looks like it's half the way it's drawn, but it's supposed to be 40% of the way there, right? So 16,000, or I guess it's 60% of the way there. Anyway, okay, so that's the expected income. But that's not what people care about, right? They don't directly care about income, which means they don't directly care about expected income. People care about utility, which means what they care about is expected utility, not expected income, okay? So if we find the utility of the low income and we find the utility of the high income, we get UI1, right? That's the low utility, and UI2, that's the utility from the higher income. And then we calculated the expected utility in much the same way, right? 40% times this utility plus 60% times this utility, and we get an expected utility here that ends up being lower than the utility from the expected income, which is $16,000. Is everybody following me so far? Okay, and this is all because of the curvature of the utility function, okay? So yeah, the person would expect an annual income of $16,000, which would give them this utility here. But that's not how people are thinking about it, right? People are thinking about their expected utility, which would be lower than the utility they got from that $16,000. Now, the next thing we'd want to do to kind of think about this further is, what is the amount of income that would make this person receive this level of utility, this expected utility? Well, the way that we do that is we go from the calculated expected utility over to the utility curve, the utility function, and down to income. And that tells us the amount of income that would give them this level of expected utility. And in this case, it would be $13,000, which of course is less than the expected income, which is $16,000. So the difference here between those two things is called the risk premium. It's the amount of money It's the maximum amount of money that the consumer is willing to pay to basically avoid this risk. Okay, so what's going on here? Because of the diminishing marginal utility, the utility of $20,000 is not simply double the utility of $10,000, right? It's smaller. And it's because those extra $10,000 didn't provide as much utility. There's diminishing marginal utility, right? Now, what this means is that the expected utility of this risky income is going to lie 60% of the way between the utility for $10,000 here and the utility for $20,000 here, which again is this expected utility figure. And like I said, we found the expected income and we can calculate the utility of the expected income. It's right here, and that's higher than the expected utility of the two risky incomes, right? The utility of the expected income, the expected utility of the gamble. So what I did just a second ago is we found the level of income that would create this level of expected utility. And it would have to be certain income, not risky income, right? Because this expected income, $16,000, that's risky, right? Which is basically why this person has a lower expected utility than the utility of expected income, right? And like I showed you just a second ago, we could find that certain level of income from the utility over to the utility function and down to income, right? And there it is. So this is what's called a certainty equivalent income, right? And as I've pointed out, it's less than the expected income of $16,000. And the difference between those, again, is the risk premium. So this, again, is the maximum that risk averse are willing to pay to avoid the risk. $1,000, right? This person would pay $3,000 to completely eliminate any. Of course, they'd be willing to pay something more, but that's the most they're willing to pay. State this slightly to make it maybe a little more clear, right? Imagine that Rock Insurance goes to this person and offers each year you give us your paycheck, bad state and you earn $10,000, or it's the good state and you earn $20,000. And in return, every single year we will give you a certain income than the certainty equivalent, $13,000. If the insurance company came to this person with the, they would say yes, definitely, right? And just to kind of go back to the graph real quick, right? And that's because basically saying we can get you a utility function, right? Because if this person just took on, they can expect this level of utility, right? And the insurance company is saying we will give you something more than that $13,000 that gets you that level of utility, right? So we'll get you to a higher level of utility. So of course, in the case where the patient or this person takes on the risk themselves, this is what they can expect. But with the insurance, they're going to get, with certainty, something more than that, a higher level of utility, right? They're somewhere up here on the curve. So of course, the person would say yes, right? So one kind of question that arises is, how far can this certainty equivalent go below expected income, right? How far how far below expected income can this certainty equivalent be? And the answer basically depends on how quickly the person's marginal utility of income diminishes as income goes up. Graphically, what does this look like? It's basically, it means that the utility function is um, more severely curved, right? So the faster it gets flatter, the more risk averse someone is, and the lower that certainty equivalent will be below expected income. Okay. Now, the straighter the utility function is, right, the less curvature it has, the more neutral the person is about risk. And in fact, someone that's perfectly risk neutral, they don't care about risk at all, they have a perfectly straight utility function. But the more that the person dislikes risk, the more curvature there will be, which makes the gap between expected income and the certainty equivalent greater, which of course makes their risk premium greater, right? All right, are there any questions so far? This is pretty technical stuff, so please stop me if you're not following. We can also think about a potential welfare gain, right, to the patient or whoever this person is, right? And that's just going to be the difference between their risk premium, right, the maximum amount that they have to pay, and what they actually pay, right, what the insurance company charges them for bearing the risk. So there's a potential, there's a possibility for the person to gain, right, to have a welfare gain. Now we have to start thinking about this from the perspective of the insurance company, right? In order for them to be able to stay in business, they have to cover their costs, and their cost is going to be the expected payout plus any sort of administrative costs, advertising costs on top of that, right? But we're going to look at this in more specific detail in the next chapter when we look at supply. But for now, we can kind of think about things in some simpler terms. But we need to define a few things more precisely in the following section to move on to that. So um, now, before we get there, we should talk about the fact that what we just did was a very, very simple model, right? Um, two states of the world, you're sick or you're healthy is basically kind of the idea, right? But of course, we know that in real life, um, events that involve illness are much more complicated than this simple idea of risk, right? But that's okay because this idea of risk aversion still remains the same, right? And that's all we really wanted to do. So if a person's utility function is defined like we've talked about before in terms of a bundle of goods X and health, and this utility function is stable, then the ideas we just discussed in this really simple model can pretty easily carry through to more complicated real world examples of health insurance. Okay. All right. So now that we understand this idea of risk aversion, we can now start to move towards the problem of how a person selects a particular health insurance policy. And to start this discussion, we're going to basically assume a very simple co-insurance type of insurance where the patient pays a fraction C and the insurance company pays the remainder, the remaining fraction. Now, of course, there are a lot of insurance policies that are much more complicated than this, but this simple plan captures the essence of many real world plans. So um, it'll give us a good idea and it's easy to use. All right, it allows us to explore the issues associated with selecting insurance. So from the consumer standpoint, they're confronted with the problem of finding a coinsurance rate, C, that maximizes their expected utility, right? That's the consumer's problem, their utility maximization problem. Now, to really think about this clearly, we need to start with some common statistical definitions. But I think you guys have a pretty good idea of these already. So really what we need to understand are the concepts of mean and variance, right? Mean is just average. And then variance is how dispersed is the distribution around the average, right? So if you have a really tight distribution, it has a low variance. If you have a really broad distribution, you have a high variance, right? There's a lot of variability. So I'm sure you guys are pretty familiar with those concepts, but if not, you can go back to box 3.2 in chapter 3 and take a look at those. Now, like I mentioned just a second ago, the insurance company has to operate in a way that is at least break even, but of course they're trying to make profits. So, but at a minimum, they have to break even, right, in order to stay in business. And so it has to charge the consumer a premium that at least covers the benefits that it expects to pay out, plus any administrative expenses or other expenses involved with running the insurance company. So for the time being, let's assume that the insurance company knows exactly the distribution of medical expenses that a person is confronted with. Even though neither the insurer nor the consumer know what the actual expenses will be, right? That's the nature of risk. It's uncertain. But let's just start by assuming that at least the insurance company knows the distribution of medical expenses. Okay, um, so let's think of this contract, right? The insurance contract says the insurance company will pay their fraction of the medical costs, right? So ignoring the 1 minus C for a second, PM, right, the price of medical care times the amount of medical care is the medical care expenditure. And the insurance company pays 1 minus C as the fraction of that. Now, another thing that we've kind of been assuming for simplicity's sake is that there's only one type of medical care. But of course, there are many types of medical care. So we can easily generalize that idea to what we're talking about here. Okay, so to think about this generalization, right? Suppose that the consumer might buy N different amounts of medical care during the year, and that each of these occurs with a probability F sub I, where I is 1 through N, right? So there's a different probability for each medical expense. We can calculate the payout by the insurance company, the expected payout or the expected benefit payment from the insurance company. It's a, this is just a pretty simple expected value calculation. This is basically what we just did a second ago, but expanding the idea to many types of insurance or many types of medical care, sorry, not insurance. So if you just think about what's inside the summation here, it's really not much different. We still have the price of medical care. We have some type of medical care, type I. So multiplying those together is the expense on that type of medical care. Fi is the probability that that medical care will take place. And then 1 minus C is the fraction that the insurance company covers. And if we add up those figures for every type of medical care cost, then we have the expected benefit that the insurance will pay out. Okay, so this is what the insurance company expects, right? Like we just said on the last slide, the insurance company knows the distribution, right? So in other words, they know the values of Fi, right? So they can calculate this for themselves. So the insurance company can calculate this. And so they basically know, all right, we should expect to pay out this much money to this person in the next year. We could simplify this if we could come up with an expected quantity of care or an average quantity of care called M star. Um, but this kind of creates a problem, right? The amount of medical care that people select is going to depend on their insurance plan, right? We saw that in chapter 2 or 3 or whichever it was, right? So that's an issue, right? Um, the insurance company cannot simply assume that M star is the same no matter what type of insurance the consumer chooses, right? It's going to depend on what the consumer chooses as far as an insurance plan goes, right? The plan is chosen in advance, and then that choice of insurance affects all subsequent choices of medical care, right? So that when the consumer gets sick or injured, the amount of medical care that they demand will depend on the co-insurance rate that they choose. So this is a kind of an issue, right? It's almost like an issue of induced demand in some ways, right? But this issue has been characterized as moral hazard. Um, but the name is kind of misleading. As Pauly has pointed out, this behavior has nothing to do with morals, and it's not even hazardous in the sense that it's predictable. So I'm not sure why it's called moral hazard, but that's what it's called, right? It's a predictable response of a rational consumer to the reduction of the price of medical care since they have insurance, right? I don't know what happened to my animations. They got all out of order, right? So this is, we've already talked about this, right? The insurance plan causes the price to fall for the patient when medical care is purchased. And so it basically causes them to demand more medical care than they would otherwise, right? And this is sort of an undesirable side effect um, when a consumer has insurance, right? So that's moral hazard, right? Um, Another way to think about moral hazard is um, I don't know if you guys know about this, but uh, so back before car insurance was a legal requirement, people actually drove more safely, right? And it's because when people know that they're covered by insurance, they don't have to care as much. They don't have to be as careful when driving because they're not responsible for the total liability that might occur if they get into a car accident, right? So that's another example of moral hazard in a different context, right? Um, Trying to think if there's another good example. Um, I guess within the context of healthcare still, when people have insurance, health insurance, they don't take as good care of their health, right? Uh, these are the same issues. These are all the same issues, right? Moral hazard. So really what's going on is there's kind of like a feedback effect going on, right? The effects of insurance coverage on the demand for care feedback on the demand for health insurance itself. So um, this creates some problems. So to think about this issue, remember that, of course, we've got downward sloping demand curves for healthcare. And so the marginal value of a particular amount of medical care consumed falls as the total amount of medical care consumed goes up, right? There's a diminishing marginal utility again, or diminishing marginal value, I guess, not technically utility. Um, and because health insurance reduces the price, it induces people to buy care that they value less, right? It creates a less marginal value than it costs to provide the care. So you basically have a welfare loss, right? The marginal value is less than the actual price or the cost. So again, this creates a welfare loss. Um, and this welfare loss offsets the welfare gains that consumers get by reducing their financial risks. So we can think about this. Let's see, do I have a graph? I have a picture in a couple slides here, not this one, but um, so there's a trade-off going on, really, right? That's really what's happening is there's a trade-off. And the choice of the consumer of the best choice of insurance, co-insurance rate balances these two trade-offs, right? So they can choose a higher C, right, which exposes them to more risk, but it has less of an impact on their demand, right? And vice versa, when you choose a lower co-insurance rate, you are exposed to less risk, but it's going to have a greater impact on your demand for medical care, right? Because you're paying a lower fraction of the costs. All right, so let's look at this again in another hypothetical simple world. And this time there's two possible illnesses, so a little bit more complex than the previous good state, bad state model we were looking at. Now there's two bad states and a good state. Okay, so of course the good state is not getting sick, and that has a probability of 1 minus F1 minus F2 if these two illnesses occur with probabilities F1 and F2. And let's assume that the co-insurance rate is 20%. Okay. And we'll also assume that there's two different demand curves for the different illnesses, right? So if illness 1 occurs, demand curve is D1, and if illness 2 occurs, the demand curve is D2. All right, so here's the picture, right? So we have two possible illnesses with different demand curves. We have the price of medical care, and then we have the price of medical care with co-insurance rate C, right? So this would be the effective price under the insurance. So without insurance, right, if the consumer has to pay the full price of medical care, with illness 1, they would demand a level M1 of medical care, but with insurance, they demand M2, right? Their demand is higher because of the insurance, right? But remember, right, PM is the cost of the care. And if we're thinking about this in terms of an inverse demand curve, the value of M2 is only here, which is below the cost, right? So if the value is below the cost, then that's going to be a welfare loss. And that's represented by this area here, A. So area A is a welfare loss given the fact that this person has a co-insurance rate C. And it's a similar situation for this worse illness, right? Disease 2, which has a higher demand curve because it's a worse illness. Okay, it's basically the same picture, just shifted to the right. Okay, so I just said that. Whoops. Okay, yeah, so. All right, so let's think about the medical spending associated with the risks of illness, right? So it's going to be distributed according to the probabilities that the illnesses are distributed by, right? So in this example, we have outcome M2, right? Because again, we're assuming that there's insurance. And when there's insurance with illness 1, the consumer chooses M2. And when that's illness 2, they choose M4. So we can multiply these outcomes by their probabilities of the illnesses and get a medical spending associated with that, right? And so that's basically what this first part is here, right? So the probabilities of those medical cares times the price of that medical care. So we basically have an expected medical expenditure or medical use, I guess, in parentheses. So the thing in the parentheses, the first one, is the expected medical use. And then if we multiply that by the price of medical use, we get an expected cost or an expected expenditure. And then, of course, the insurance company covers 1 minus C as a fraction of that, right? So that's the benefit that the insurance company expects to pay, given the fact that there's these two possible illnesses. All right, so let's put some numbers to these so that we can kind of put this into use, right? So we already are assuming that C is 20%. Let's assume that the price of medical care is $500 per hospital day. The choice of medical care under disease 1 is 4 days in the hospital. The choice of medical care under disease 2 is 9 days in the hospital. It's a worse illness. And the probabilities of these illnesses are 30% chance for the first illness and 10% chance of getting the second illness. We can then calculate this expected payout by the insurance company, right? It's the $500 per day in the hospital times the expected number of days in the hospital times the rate that they pay, right? So they pay 80% of the cost. So with these numbers, it ends up being $840. So that's what the insurance company expects to pay out. Okay, so what does the consumer have to pay for this? Well, it's going to have to pay something more than the $840, right? Otherwise, the insurance company would lose money on average. So it's going to be the $840 plus any sort of loading fee, right? So this covers the administrative costs of the insurance company and anything else that they have to pay for. Okay, so a lot of times this loading fee is just a percentage of the expected benefit. So for example, if the loading fee is 10%, then the actual premium charged will be $924, right? $840 for the expected payout plus $84 for the loading fee, right? That's where 924 is coming from. 840 plus $84. Okay, so this would be potentially a possible premium charged to the consumer. And of course, on average, the insurance company profits $84, right? The loading fee is basically their, well, I guess not profit, because some of this is going to go to administrative costs, but I guess in a sense, it's the profit that's over and above the expected insurance payment. Okay, so the welfare gain to the consumer is going to depend on two things: the risk premium, right? Their willingness to pay for risk reduction, and the size of these two triangles. Okay, because again, these represent welfare losses, but depending on their risk aversion, they might overall have a net benefit in their welfare. Okay, so let's assume that these triangles have areas of $200 a piece, right? That's the loss, is $200 a piece. Well, then we can expect that the welfare loss will be $80, right? There's a 30% chance of illness 1, which would lead to a $200 welfare loss. And there's a 10% chance of illness 2, which would also lead to a $200 welfare loss. So the expected welfare loss is $80. So the only thing left we have to know is the risk premium, right? What's the consumer's maximum willingness to pay to avoid this risk? Well, we have to know their utility function to figure that out, right? So let's just suppose, right, that we know their utility function and we calculate their risk premium to be $220. So this means that the consumer is willing to pay the risk premium plus the expected benefits minus the expected welfare loss. Okay, so the risk premium plus the expected benefits gives us $1,060. But then we have to take into account the fact that they face this potential welfare loss of $80. So the most that this person would be willing to pay for this insurance is $980. So is there a welfare gain? Let's find out. Well, it depends on what the company charges, right? So if this is the maximum willingness to pay by the consumer, and then the insurance company charges something less than that, then the consumer gains the difference. Okay. So even though there's even though there's welfare losses created by this insurance, it's still possible for the consumer to have a welfare gain. Right. So any consumer that is maximizing their expected utility is going to think about all of the possible co-insurance rates that are available and then pick the one that gives them the highest net gain. Right. So we looked at one example, right? We looked at an example where there's a co-insurance rate of 20%, but there's different options typically, right? There's going to be one that's a co-insurance rate of 10%. There's going to be ones that are higher than 20%, right? There's going to be a variety of options with different prices. And the consumer is going to pick the one that gives them the highest net benefit or the highest net gain. But of course, remember that there's sort of a balancing act going on, right? A lower co-insurance rate reduces the risk, but it creates higher welfare losses, right? It creates bigger A and B triangles, in other words. But the opposite is true for higher co-insurance rates, right? There's going to be less risk reduction because the consumer has to pay a higher percentage of the medical care costs. But it's also not going to generate as much of a welfare loss when they purchase medical care. All right, how's everybody doing? We good? Everybody good? Any questions? This is a really technical chapter, so again, don't feel embarrassed if you are not understanding something. All right, well, so that's all we're going to cover for today. So hopefully on Monday next week, we will be able to wrap this chapter up. But going on from here, we're going to continue looking at the choice of insurance policy. There's a few issues we haven't covered yet regarding the choice of insurance. And then we're going to start thinking about the role that the Affordable Care Act has played in this choice of insurance. Then we'll look at this issue of stability in the insurance market. And this the question is really this question of what's called self-selection, right? So consumers are self-selecting insurance, and that creates some interesting problems. Then we're going to move on to look at the subsidization of health insurance through income tax, which is related to the Affordable Care Act. Then we'll take a look at some evidence regarding the demand for insurance. So look at some empirical evidence. We will look at the effect of tax subsidies on the healthcare sector. We will then talk about optimal insurance, or efficient, in other words, efficient insurance. And then we'll look at a few other models of demand for insurance that are sort of new or untraditional. Okay, and then that's the end of the chapter. So that's what we have to look forward to next week. In the meantime, let's see. I guess you guys have a homework that you should be working on for next week, right? That's due Tuesday, so you still have plenty of time. But that's where we're headed. And then if hopefully if we can wrap this up on Monday, we will move on to chapter 11 on next Wednesday. And then I guess, what do we have, like 3 more weeks of class, I think it's 3 weeks. Maybe it's 2. I don't know. I think it's 3. Hopefully it's 3. We have quite a bit of material I want to cover still. So, but in any case, that's where we're headed. So are there any questions about anything? Okay. All right. Well, y'all have a nice weekend, and I'll see you on Monday.